The title of this screencast is, as it says here, the performance enhancing and recreational substances or drugs that a performer or a participant or human being might consume. The screenshot of the specification at the bottom details what you need to know in this area. So you need to know about the different categories of drugs. So in a performance enhancing context, we're talking about anabolic steroids, beta blockers, diuretics, narcotic analgesics, stimulants, peptide hormones, primarily EPO. On a more recreational level, we're talking about the dysfunctional behaviour of alcohol and smoking, and looking at what effects will they both performance enhancing and recreational have on health and well-being, but also their physical impact on performance. You also need to show an appreciation for why a performer may well resort to performance enhancing drugs. Throughout this screencast, it seems apt that we'll use Lance Armstrong as a contemporary example of somebody who took all of the performance enhancing drugs that you need to know about. So we'll make it all specific and relevant to him. So why did he do it? Why did he go down this route? Why did he take those substances and put them into his body? The reasons I've documented down the right hand side are as follows. Firstly, we could attribute it to pressure from sponsors. So the global companies that he receives a financial income to represent, they want to be associated with his success. And if he feels that that success is in jeopardy, he may well feel obliged to honour that contract and possibly resort to cheating or performance enhancing drugs to maintain not only his profile and reputation but that of those companies. There's also the possibility that if he perceives that his performance level has plateaued, so if he's reached his physical limits naturally, if he feels like his training is not providing any gains, then he may well seek an edge and a spike in performance by using drugs. Very appropriate to him, obviously, with the various medical conditions that he's experienced, primarily cancer. It may well be that the psychological impact of that was his confidence was dented, as well as the other physiological effects. So he may well have taken these drugs to try and return to what his condition was, physical condition, prior to being ill. He may well have looked along the start line of the Tour de France and been of the belief that everybody else was doing it, and that he should conform to avoid not being disadvantaged in any way. And then the final one that I've made reference to is possibly naivety. More and more performers being caught taking drugs are suggesting that they're not to blame and that their sports scientists and nutritionists gave them a substance to take that they thought was innocent and healthy. So these are the reasons why in sport drug abuse and performance enhancing drugs is so rife, and why people go down that route. So these are the performance enhancing drugs that you need to be aware of, and as mentioned before, you need to know what each drug does to performance. So what are its positive impacts, how might it make you more effective in your discipline, and also what are the implications on your health, or what are the side effects. We also need to know some examples of sports people who might pursue these particular drugs. So we'll start off with anabolic steroids. So Lance Armstrong took anabolic steroids primarily, you would imagine, to increase muscular strength and to increase muscular power. He would need this for his start of his cycling races, maybe for sprint finishes, maybe for leg drive when climbing through the Alps. They're also associated with quicker recovery times, which is very significant in the Tour de France, with a quick turnaround between stages. You don't traditionally see cyclists taking performance enhancing drugs because it isn't preferable to be too heavy and to carry too much mass on a bike. Normally we would see the likes of sprinters and American footballers maybe, who need that dynamic power output and muscle mass and size. They're the more preferable, more normal, stereotypical people who might use anabolic steroids. So those are the impacts on performance, but the impact on health is that Lance Armstrong ran the risk of developing female characteristics, So becoming infertile as a male, developing female breast tissue, and then some of the other consequences like aggression, bad skin, and possibly insomnia as well, mood swings. The next performance enhancing drug is diuretics. So Lance Armstrong took diuretics to not necessarily lose weight, because diuretics remove all water from your body through urine, so that you might lose any body weight in order to make a weight category if you were a jockey or if you were a boxer or a martial artist. He didn't take them for that reason. He took them because by removing high levels of or high amounts of water from your body, you're also masking or stopping other drugs being traced. So he did it as an opportunity or as a method to not be caught taking drugs. So the positive impact on performance of these is that you might be able to lose a lot of weight very quickly and remove other drugs from your system. But the impacts on health are that if you're removing all that water, you're going to become dehydrated, and the impact of dehydration is dizziness, headaches, nausea, which obviously is going to have a significant impact on performance. So your reaction time will be diminished, your concentration and your coordination as well. So not ideal for somebody realistically taking part in a road race. The third performance enhancing substance is narcotic analgesics. These are associated with pain relief. So Lance Armstrong will have taken these to help mask the pain of his various injuries and ailments. So if he's suffering from muscle strains or muscle tears, or any other sort of joint related tendonitis, overuse injuries, he can take narcotic analgesics in various forms to hide that pain so he doesn't feel it, and he can continue to train and continue to compete and represent his sponsors and win the race. Other activities that this might be associated with stereotypically might be sort of contact sports like judo, where we tend to see lots of tissue injuries. So that's the impact on performance. It allows you to carry on training and participating in the face of pain. The impact on health of that is that the injury isn't going to get any better. If anything, it's going to get worse because your body's trying to tell you to rest and you're just hiding that injury. You also run the risk of addiction. They tend to be very addictive. Things like morphine and heroin are examples of narcotic analgesics. Other implications are cardiovascular disorders. You may be able to be prone to strokes and to heart failure. Next is stimulants. Stimulants are associated with improving reaction time and alertness and concentration levels, and they're also associated with allowing you to train for longer. So normal stimulants on the shelf might be things like caffeine, Pro Plus. More illegal, unconventional stimulants might be things like ephedrine, which just make you more hyper aware of your environment. The impact on performance is obviously, as just mentioned, we would see a cricketer more likely to be able to be ready for a catch. We would see Lance Armstrong maybe able to train and continue effort for longer periods of time, and maybe more aware of other people in the peloton and their moves tactically. The impact on health, though, is that stimulants are associated with insomnia, because if you're becoming more alert and more aware, your capacity to relax is probably diminished. Also associated with dehydration, and there is also scope for these to be addictive as well. The penultimate performance enhancing drug that we'll look at is beta blockers. Beta blockers, the impact on performance is that they slow down your heart rate, they calm you down, they have a calming effect. These are issued to people who suffer from stress and anxiety to have that same effect within their daily life. In sport, that's of benefit if you need a steady hand, if you need to be able to concentrate, if you need good hand-eye coordination in the face of high arousal or high pressure. Beta blockers is not something you'd necessarily associate with Lance Armstrong, because if you're slowing down your heart rate, obviously that's going to negatively impact your cardiovascular system and the delivery of oxygen and the other nutrients. So in truth, I would imagine that this is possibly one of the ones that he didn't consume. He may well, for all we know, consume them pre-race to allow for better mental rehearsal and to allow him to maybe focus in and zone in a little bit. The impact on health of beta blockers is that it can cause complete heart failure. So if you're slowing down and messing around with heart rate, you do run the risk of the heart reacting and actually just ceasing to pump and to contract. Can also make you quite faint and be prone to losing consciousness and passing out as well. The final performance enhancing drug then would be peptide hormones, specifically concentrating on EPO. So EPO works very similarly to blood doping, and it stimulates an increase in red blood cell count. Now, from our work on the cardiovascular system, we know that that means more red blood cells equals more hemoglobin, means more oxygen carrying capacity, so greater cardiovascular endurance. This is obviously important for Lance Armstrong across a Tour de France stage, and also important for athletes like these Ethiopians and Joe Pavey, who take part in 5,000 and 10,000 metre races. The effect of health on peptide hormones is that we can, by increasing red blood cell count, make blood arguably more thicker and less fluid, which might cause obstructions and blockages and clots that might cause significant issues with the heart and with the brain as well. So having reviewed the drugs that Lance Armstrong ultimately did consume and did take to boost his performance, and reviewed what impact that would have on his health, we now just need to look very quickly at some recreational drugs or recreational dysfunctional actions that Lance Armstrong, you would imagine, wouldn't risk and he wouldn't reject, such as their effect on the body's capacity to be physically active. So first of all, we'll look at smoking. Whenever looking at smoking and alcohol and their effects on the body, it's worth just working through the body systems and exploring what smoking would do to those various systems. So the effect of smoking on health is that it will make skin and fingers in particular go a yellow colour, which can be very sort of antisocial. It would also increase the likelihood of cancers, primarily lung cancer and throat cancer. It will also make heart attacks and heart disease more probable. You're also more prone to conditions like bronchitis, so an infection of the airways, emphysema, so damage to the airways in the lungs, maybe pneumonia, so an inflammation of the lungs, and also strokes as well. There's no way Lance Armstrong would smoke because of its impact on performance. So anybody who smokes is significantly limiting their capacity to utilise oxygen. Carbon monoxide will replace oxygen attached to hemoglobin, which means that no longer are we delivering oxygen to the working muscles, but carbon monoxide, the poison, which means that cardiovascular endurance will be significantly diminished. So there was no way that he would risk it in his endurance activity. Just finishing up with alcohol then. The impact of high amounts of alcohol consumption on health are that you're more susceptible to liver conditions, liver disease and liver cancers. You're more susceptible to alcohol poisoning. You might be more prone to diabetes, and cancers throughout the body might also be more probable. As well as the sort of social negatives of being an alcohol consumer. The negative impacts on performance would be that Lance Armstrong, his balance would be thrown out, so he might fall off the bike a bit more. His hand-eye coordination might be limited as well. His reaction time and his response time will be reduced, and also his ability to generate force against a resistance, so his strength would also go down. So again, something that you would imagine he would not even consider doing.